In this lecture, we will discuss the PR segment, specifically what it represents and how it should normally appear on the EKG. So the PR segment represents the time from the end of the P wave to the start of the QRS complex, okay? So if you look here, this is our P wave, this is our QRS complex, this is our T wave. Our PR segment is from the end of our P wave, which is at this point here, to the start of our QRS complex, which is that point there. So this portion here is what's considered our PR segment. It represents the impulse transmission through the AV node, the His bundle, the bundle branches, and the ventricular Purkinje system, along with some of the atrial repolarization. Okay, so again, here's our sinus node. We'll go over our conduction system. We have the internodal pathways, the Bachmann bundle that goes to the left side, to the left atrium, our AV node. Then we have here our His bundle. Okay. Then we have our bundle branches. On the right side, we have the right bundle branch. And then on the left side, the left bundle branch that has this left anterior fascicle and a left posterior fascicle. And then from those bundle branches, we get the Purkinje fibers that come through them that innervate our myocardial cells, okay? And then we have our cell-to-cell depolarization. So what we're saying here is that the impulse is going from the AV node, so through our AV node, through the His bundle, the bundle branches, and to the Purkinje fiber up until ventricular depolarization is what we consider our PR segment. And remember, we can also have some portion of the atrial repolarization wave occurring here. Remember, the P wave represents atrial depolarization, so somewhere in this region, okay, you can see a TA wave, which represents atrial repolarization, but oftentimes that area is not present, okay, and insignificant, and it's often sometimes buried within that QRS complex, so that PR segment will remain flat and isoelectric. Now, one thing to note is that after a lot of controversy, they've come about that the PR segment is considered the baseline when determining ST elevation or ST depression. Okay, so what do we mean by that? So this is their PR segment, and if you draw a line through it, we use that as our baseline to determine, is there any ST elevation? So this is our ST segment from the J point, or the end of the QRS, to the beginning of the T wave. Is it elevated or is it below? Elevated meaning ST elevation, or below meaning ST depression. So the PR segment is our baseline for determining that. Now, most of the PR segment represents AV nodal conduction delay. Now, something important here is this delay. Okay, it's a normal physiologic delay. Without this delay present, the atrium ventricles would contract simultaneously, and that would lead to ineffective blood flow from the atria to the ventricles. Okay, so having this delay present at the AV node is a normal thing and important for this process. Now, the PR segment we said is flat, isoelectric, and often located along that baseline, right? We use that as our baseline or the reference point. The PR depression, if you see this, normal PR depression if it's present, okay? So PR depression, if you imagine that, it would be going down, all right? So this area here would be PR depression, and normal is less than 0.8 millimeters. Okay, remember, one small box from here to here is 1 millimeter, so this is even less than that. So about this portion here would be 0.8. Now, in terms of PR elevation, so now the other way, where we have our P wave and now it'd be elevated. Okay, so from this to this, normally, if you see it, normal is considered less than 0.5 millimeters. Okay, so if we have our small box present, which represents 1 millimeter, that would be half the box, okay, is considered normal PR elevation. Now, the differential diagnosis for PR elevation and PR depression include the normal variant if they're within those normal levels, so less than 0.8 depressed or less than 0.5 elevated, pericarditis, atrial infarct, and atrial repolarization wave, right? We said that TA wave, the atrial repolarization wave, can be present and cause some depression there. Remember, it goes in the opposite direction of our P wave. This would be our P wave, and if we had the TA present, that would be present there, okay, representing atrial repolarization. All right, let's briefly review what we discussed before we end here. So the PR segment represents the time from the end of the P wave to the start of our QRS complex, so from this portion here. It represents the impulse going through the AV node, the His bundle, the bundle branches, and the ventricular Purkinje system. It may also include some of the atrial repolarization wave. It's considered the baseline when we're looking to determine ST elevation or ST depression, meaning it's the reference point of what we consider this flat portion. Now, it makes up most of the AV nodal conduction, makes up most of this PR segment, okay? That conduction that's happening at the AV node. And remember, this is important because without this conduction delay, the atrium ventricles would contract at the same time. And if that happened, we would have ineffective blood flow going from the atria to the ventricles. Remember, the PR segment normally is often flat, isoelectric, and located along that baseline, okay? Located right along there. If it's elevated or depressed, it's normal if it's less than 0.8 millimeters depressed, and it could also be normal if it's less than 0.5 millimeters elevated. All right, so that would be considered our normal variant. Some cases where you would have more significant clinical features would be in pericarditis. Okay, you can see more significant PR elevation or depression, atrial infarction, as well as an atrial repolarization wave, or that TA wave that we've mentioned. Well, that's the end of this lecture. We discussed the PR segment, specifically what it represents, and how it should normally appear on the EKG. I hope you learned something.